Hello everyone, my name is Curie Rush and this is my assignment for the gender-based medicine assignment. First I would like to go over the difference between sex and gender, and then I have a quick skit where after my husband Joseph Rush, who is an expert in the field of radiologic science, will explain the scenario in a little further detail. So, the differences between male and female sexes are anatomical and physiological and relate to the biological differences. The male and female genitalia, both internal and external, are obviously different. Genetic factors define the sex of an individual. Women have 46 chromosomes as well as men. But the female has two X's and the men have both an X and Y. The Y is the dominant and carries the signal to the embryo to begin growing testes. Both men and women have testosterone, estrogen, and progesterone. Women do have a higher level of estrogen and progesterone, and men do have higher levels of testosterone. Gender denotes the social and cultural role of each sex within a given society. People often develop gender roles in response to their environment, so including family, interactions, media, peers, and education. Please enjoy our skit.
Mr. Snowman? Right here. Hey, Mr. Snowman, come on back with me. Okay. Hi, Mr. Ollie? Yeah, my name's Ollie. I'm the CT tech. I'm going to be doing your exam tonight. Okay. Can you, tell me what your first name is, Mr. Snowman? Winter? Alright, Winter. What's your birth date? December 25th? Oh, that's a good birth date. Alright. You ready to go in CT? Sure. Alright, follow me and Mr. Snowman. We're going to come right into CT. Come on in. This is my CT scanner right here, Mr. Snowman. Okay. Mr. Snowman, have you ever had one of these CT scans before? Once before for my head. Okay, Mr. Snowman, I'm going to be doing a CT scan of your abdomen and pelvis today. What exactly brings you in? Well, I had a recent bowel obstruction and I don't know if it's resolved and now I got a lot of pain and bloating. Okay, so based on your history and stuff like that, it looks like the radiologist protocoled this exam to have some special contrast put in. So, I got my enema catheter right here. This is actually going to be used to give you some rectal contrast because we're looking for a bowel obstruction. Huh? Yes, rectal contrast. So what I'm going to have you do actually is I'm going to get you on my table and we're going to basically introduce my catheter with some contrast through your rectum, and it's basically going to enhance the large intestine to see if you've actually perforated your bowel or not. And if so, this won't hurt you as much and I'll actually have to take you to the OR. I don't know about this. Do you have to? Well, that's what the radiologist would prefer so that we can get the best possible images so that they could truly diagnose it. I don't know if I can do that right now. Okay. Is there something I could do for you? Do you have a family member you need to bring back? Kind of hold your hand for a second? I wouldn't mind that. No, but if I could have my nurse, she was very nice. Okay, let me go grab your nurse. Alright, Mr. Snowman, Autumn just showed up, your nurse. Autumn's gonna be here the entire time while I get you all set up. So what do you say? Can you hop onto my CT scanner for me really quick? Okay. All right. So Autumn is gonna basically watch while I introduce my contrast eye into your rectum. You're gonna feel a little bit of pressure here. Just need you to roll over onto your side just a touch. All right. Just like that. This is a small little catheter. You're gonna feel a little pressure. All right, Autumn, you ready? Yes, I'm ready. Okay, there it is, Mr. Snowman. I'll have you roll back on over. Oh my God! Oh, that doesn't feel good. Yeah, it'll just be there for just a second. I just need to introduce my contrast eye, and we've got the scanner being set up right now to do your scan. Oh, please hurry. Please hurry. This hurts. This hurts. This hurts. All right. All right, just hold real still. We're going to step out and do that quick scan. All right, Mr. Snowman, we're all done. I got great pictures. I just need to take that catheter out really quick. All right, let's get you cleaned up and get you on out of here. Autumn, can you help him out with that? Okay. Hey, Autumn. Thanks a lot for coming over to help with Mr. Snowman. I was really confused. He is... I didn't understand that Mr. Snowman was a Mrs. Snowman or a Miss Snowman. I really didn't understand what was going on there. Yeah, Ollie, I'm sorry. I should have come over and told you ahead of time. I just didn't know that you were going to be doing such an invasive scan. Yeah, the radiologist really wanted to double check to see if he had a perforated bowel. It was the quickest way instead of having him drink that contrast and wait a couple hours. And we'll actually have results back here very, very shortly. And if he does have something wrong, it'll be diagnosed pretty quickly here. Look at myself. I keep calling him he. I was so confused. I'm so sorry, Autumn. I'm thankful that you were here. I'm only by myself, and usually if I have to deal with a female patient, I just need to have a chaperone like you to actually just make sure everything was good. Otherwise, with most of the guys, they're pretty chill. They hop up on the table and we do our business and get them on out of here. But that worked out a lot better having you there, and I appreciate your help there, Autumn. Oh, not a problem, Ollie. You have a good night. All right. Bye now. Hi, my name's Joe, and I'm the actual CT tech portrayed by Ollie. A few years ago, I actually was in a similar situation where I was introduced to a patient while working a night shift, completely by myself, the only CT tech, with one other x-ray tech that was another male. And I met this patient, Mr. Snowman, who actually wasn't a Mr. It was a Miss Snowman who had just gone over a new gender transformation. It was completely new to me. I've never really been exposed to much LGBT community of any sort. And then all of a sudden, I had this one patient that was extremely reluctant to kind of go with things. It took me a while to actually get the order protocol properly from the resident that was working that night. And they really, wanted rectal contrast, even though I was like adamant that oh, come on, it's, 2 o'clock in the morning. I don't really want to be doing rectal contrast on any patient, let alone right now. And just so happened that they wouldn't allow me to push back. So, typically with most male patients, I would just grab them, bring them back, explain the whole procedure, just, be as nonchalant and, upfront, very courteous, understanding all their feelings. There's a lot of things that obviously can go, through your mind whenever you're told, hey, look, I got to take this enema tip and stick it in your rectum and then fill you with contrast. It's going to be warm and going to make you feel comfortable. Let alone have a female, which you don't know that it's a female,
feel almost violated just by having another male say that they're going to be doing this. Typically, we do have actual protocols in place at the hospital that would actually have a female present to do the exam. Typically, it would be like a nurse or just any other staff member, clinical staff member, just a chaperone. And if there was another female tech, we would always defer to them to, at least place the the tip and go from there. That scenario actually worked out pretty well for me because I was actually able to go over and talk to the physician, talk to the nurse. It was actually very interesting. The physician didn't even know that Mr. Snowman was a Miss Snowman. There was nothing in the chart. It was, medical record was all, he was a new patient to the facility. There was no mention of his gender transformation or anything like that. And it was a pretty challenging exam, but I was able to actually get through it with having a chauffeur present. But it goes to show knowing your audience is one of the biggest challenges, and how to actually be able to talk to them to get as much information out without causing any so just proper communication, understanding truly what you're up to do, knowing your audience extremely well, and being able to pose the proper questions ahead of time, and then get the support. I think it's important for staff to be trained on scenarios similar to this, and then actually have some sort of action in place, and that way, if you are found by yourself in a scenario, you could easily maneuver through it, knowing that you have those resources. All right, thank you.
Thank you, Joe, for that insight. I just wanted to go over just some quick information before we wrap it up. While radiographers rely on medical records and professional experience to treat their patients, many may not have the knowledge to interact with the transgender community. As we saw with Joe, this was a new experience for him. According to a recent study developed by the Joint Commission, 56% of the LGBT patients experience some type of discrimination in healthcare, and 70% of gender non-conforming patients surveyed have experienced some type of discrimination as well. Too often, patients do not receive care that is understanding and compassionate as it could be, in part because health professionals are not well educated on sexual issues and patient care. Fortunately, there are ways to improve that. One of the first opportunities to provide culturally competent care to transgender patients is in the waiting room or triage areas. Examples include printed materials such as posters, brochures, and magazines that show a commitment to servicing the LGBT community. Competency training that addresses transgender health for clinical personnel enables radiology personnel to feel more prepared to interact with transgender patients. Recognizing and respecting patients' cultural identity helps discourage stigmatization and avoid preconceptions about gender identity and sexual orientation. And then asking patients preferred names and pronouns is another step that can go a long way. We want all patients to be treated the same no matter what. All organizations should work together as a team to create a culture that is inviting to all. Thank you so much.